Good afternoon and welcome back to Health Leaders, the Winning Edge program. This is a weekly series of webinars that's touching on the topics and strategies that you need to know most. My name is Marie DeFreitas and I'm the Senior Finance Editor for Health Leaders, and I'm going to serve as your moderator for today's session. So today's webinar is titled The Winning Edge for Cost Containment and is sponsored by Health Trust. Thank you so much to our sponsor for making today's program possible and to you and our audience for participating. Before we get started, those of you participating in our live program, I just have a few housekeeping details to talk about first. So our program is going to be approximately 60 minutes in length, and just know that an on-demand version of this program will be available on our YouTube channel on Friday, and this can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, just make sure you maximize your event window and be sure to adjust your computer volume settings or PC speakers for that optimal sound quality. Next, you're going to find a resources list for today's webinar, and that's going to be in the upper right-hand corner of your screen. Here we'll have listed the webinar slide deck and some additional materials for you to download, along with a registration link for the future The Winning Edge events. At the bottom of your console are going to be multiple widgets you can use. To submit a question, you're going to click on the little Q&A widget. It may be open and already appear on the left side of your screen. You may submit questions at any time during the presentation. However, please just note that it's likely your questions will not be answered till the Q&A portion of the program at the end. Finally, should you experience any technical difficulties during today's program and you need assistance, please click on that little help widget, which has a question mark icon, and that's going to cover all your common technical issues. So at this time, it is my pleasure to introduce our panelists. First, we have Lynn Ansley, who is the Vice President of Revenue Cycle Management at Moffitt Cancer Center. We have James Dragney, who is the Vice President of Finance and Operations and Chief Financial Officer of Sauk Prairie Healthcare. And we have Richard Philbrick, who is the Senior Vice President of Strategic Accounts and Performance Solutions at Health Trust. Thank you all for joining us today. Can each of you just tell us a little bit about yourselves and your organization real quick? Lynn, do you want to start first?
Absolutely. Well, good afternoon, everyone. My name is Lynn Ansley. I'm the Vice President of Revenue Cycle at Moffitt Cancer Center. Moffitt Cancer Center is an NCI-designated comprehensive cancer center located in Tampa Bay, Florida. We have 2 inpatient facilities and several what we call Moffitt ambulatory campuses around the Tampa Bay area. We do a large portion of clinical research and clinical trials at Moffitt Cancer Center, and our team member counts about 10,000 team members currently and growing.
Awesome. Jim, do you want to go next?
Sure, thank you. I'm Jim Dragney. I go with a shorter title. I just say CFO at Sauk Prairie Healthcare, but Sauk Prairie Healthcare is an acute care hospital and health system located in Prairie du Sac, Wisconsin, just north of Madison. We are a fair amount smaller than Moffitt, but a lot of the things we're going to be discussing today are really irrelevant of the size. A lot of organizations, regardless of size, have the same challenges with cost containment and challenges. So very happy to be and honored to be participating today.
Thank you. And Rich, would you like to go next?
Yes, thank you, Marie. Rich Philbrick, as Marie said, from Health Trust Performance Solutions. Health Trust is a group purchasing and performance solutions company focused on supporting our member partners in the delivery of high quality healthcare sourcing and supply chain solutions that benefit them. We've been in existence for 25 years. One of the unique things about Health Trust in terms of in the GPO space, we are the only GPO that's owned and operated and managed by supply chain operators. I've spent 25 years before moving into this role in finance and supply chain operations, and that's consistent. So I love the opportunity to participate in this panel. As James said, we have members, we have members from small rural critical access facilities to very large health systems. 6 of the largest health systems in the U.S. are part of Health Trust, and they are all facing very similar challenges in cost containment. So look forward to the discussion today.
Awesome. Thank you all. All right. So firstly, like I said, our topic today is cost containment. And this is obviously a huge component to a finance role, right? But there are also so many different factors that play into this, and we're going to get into a lot of them today. I just want to start us off with a couple numbers just to get us in the headspace of this topic. So in 2025, healthcare costs are projected to rise somewhat significantly, between almost 6 and 8%, and with a few contributing factors here being inflation, increased utilization of like more expensive treatments, usually from that aging baby boomer population that we're seeing now, and also things like pharmacy costs with all these new like specialty drugs. So on top of all this, we also have a new administration that's coming in pretty hot and fast with policy changes. So there's still so much we don't know or don't understand yet about how healthcare costs will be affected. So let's dive into it. So our first question is, what would you say are the most pressing financial challenges for health systems that they're currently facing, and how can cost containment help address these issues? Lynn, would you like to kick us off on this one?
Absolutely. So for us, it really comes down to the volatility and unpredictability of reimbursement. We are an oncology center, so as you can imagine, the cost of treatment is very expensive. And at Moffitt, our mission is the prevention and cure of cancer. And so we often say no margin, no mission. So really securing that reimbursement is one of the largest pressures that we have both today and with the unpredictability of changes in that reimbursement in the future. And then going to how cost containment can help us there. Being the vice president of revenue cycle, we measure everything. And with cost containment, it's not just about our labor and leveraging our people, process, and technology in the smartest way possible, but it's also going back to basics. Sometimes with cost containment, when we look at reimbursement and how we can contain our costs, it really is redefining how we look at how we process through the widgets that make a revenue cycle. So that's one of our key focuses today. It's just continual improvement to really combat the risk to reimbursement that we anticipate in the future.
For sure. Jim, do you want to go next?
Yeah, I'd echo what Lynn said on reimbursement challenges and some of the processes in the revenue cycle in particular. But in addition to that, just the payer contracting. We are actually out of network with Anthem because we were not able to reach an agreement. And there are a number of systems recently, within the last year, that have needed to take that step with Anthem and terminate the contract in order to try to get them back to the table to negotiate some rates that help support the work that our teams do. But in addition to the reimbursement rates, there's also the tactics of deny, delay, and defend, the initiatives that they are implementing. I like to think that everyone in healthcare is working to make the processes easier and more efficient. But in some of the initiatives that payers are implementing, it seems like they're actively trying to make it more challenging to get paid. And that it puts a lot of strain on the systems. But in addition to the reimbursement side, obviously cost is critical, and supplies and drug purchases. So we're trying to attack everything that we can, but those are the things that are impacting us the most.
Yeah, for sure. No, definitely reimbursement, always a pressing challenge. Rich, how about you?
Yeah, very similar. Depending on where I was selected in this question, I figured I'd gear my answer that way. Top of my list, of course, was all the uncertainty that Jim and Lynn just mentioned in the reimbursement platform, and just the challenge that we see coming with potential Medicaid cuts, healthcare subsidies, all of those things that I know really challenge the top line. the denial pressures for sure. But I guess since since Lynn and Jim covered those well, I'd shift gears a little bit to some of the other kind of cost pressures that Jim mentioned. Certainly, we continue to see real challenges on the labor side. This was accelerated during and coming out of COVID, but continues really to be challenging to be able to staff our hospitals efficiently, effectively with the right amount of nursing. Physician recruitment is a challenge for sure. I think some of the big strategies that I'm seeing deployed, and I think are very important to containing these costs are retention efforts for sure. It's a lot more expensive to onboard a new staff than it is to try to maintain them, even if there are higher rates or increased benefits. Certainly contract labor pressures, I think, have subsided some, but still, I'm sure are challenges for our CFOs here on the phone. And I'd be remiss to not, as the supply chain representative on the phone, to not discuss all the pressures that we're seeing in supply chain. The tariffs, I know that everybody is so aware of and is threatening to continue the increases that we've seen even before then. There's the disruption that we've seen, something as simple as a hurricane in North Carolina that completely wipes out our IV supplies and increases costs there. So certainly significant pressures that we are facing and containing costs and putting in inventory management solutions. Lynn mentioned the processes that she's putting in place to effectively manage the rev cycle. Those things, same things apply in supply chain. Creating efficiencies in our procurement processes are key and to helping support our facilities even as we see challenges on the top line.
Definitely. Yeah. Like I said, there's so much that goes into this. I feel like, we have a lot to dig into for sure. So I wanted to touch on value-based care a little bit within this discussion. So value-based care models are coming into play more and more, and that whole objective here is to shift from volume to value. So I want to ask how would value-based care models influence cost containment strategies in health systems? And Rich, do you mind taking this one first?
Sure. Well, again, a big piece of it, I think, is that shift to quality and outcomes, a focus on preventive care and managing disease states. Will emphasize, early intervention, preventive screenings, and things like that. I think there's the possibility, if effective, that reduces a lot of the costs that go into emergency visits and longer hospital stays. So certainly, if we can make that shift, we should see the ability to help on the cost side for sure. I think one of the big efforts, in value-based is a coordination of care, from our primary care providers, our specialists in our hospitals, and for those who have had loved ones in our health systems. So that can still be a challenge. So if that can be improved, I think it can help eliminate duplicative procedures and costs, testing, and all those kind of things. So certainly, I think there's some real value that we can gain in cost containment as we move, I guess, rather slowly, but certainly steadily towards the value-based care models.
For sure. Jim, what are your thoughts on this one?
Yeah, care coordination is such a critical component of value-based care models, and trying to eliminate, like Rich said, duplicate tests, images, trying to manage the population and prevent individuals with chronic conditions in particular from needing to receive services in high-cost settings, such as the emergency room, inpatient areas, seeing them in low-cost settings, such as primary care clinics. So primary care is a very important part of value-based care models. But one other component that may affect smaller systems a little more is access to data. That care coordination really needs to provide information for the primary care physician on all of the services the individual is receiving, whether it's within their system or at a tertiary larger system. If someone is going to a primary care physician in a small system, but for some reason they need to visit an ER in a large system, if that primary care physician doesn't get the data that shows this individual is going to the ER multiple times for, a diabetes related concern, it's hard to manage that overall care. How can that physician prevent that ER visit? In some cases, it's very difficult to get that additional information from payers because in some of the situations we've looked at, payers blame it on HIPAA. They can't provide that information. But really, to provide the best overall care of that patient and their member, that data needs to be shared. So there needs to be a collaborative partnership to really reduce cost for the patient and the industry overall.
For sure. No, definitely data, I think, is a huge component to this. Yeah, definitely. Lynn, is there anything you wanted to add to this one?
I would just say there's a strong focus on patient outcomes and improving patient outcomes. In oncology, focusing on preventative services like screening to diagnose a cancer patient sooner before their cancer has progressed has a direct correlation to cost containment, right? We have more options. The sense of urgency of the treatment is not as great if the stage is earlier. And so I really think the preventative services and focusing on that from a patient overall outcome perspective is really important in oncology settings.
Yeah, definitely, for sure. Yeah, definitely. Preventative care is definitely a huge component to value-based care. And that's something I wanted to touch on as well. And I think even things like health equity and social determinants of health also kind of play roles coming into this. So for the next question, if we want to elaborate on this a little bit more, what role does preventative care play within cost containment? And how can health systems shift more of their resources into preventative care without jeopardizing other services? Jim, do you want to start us on this one?
Sure. Well, like Lynn said, preventive care is the basis for value-based care, and identifying conditions before they develop into full-fledged diabetes or other chronic conditions. It's much cheaper to treat those conditions early on and try to prevent something from developing into a high cost or chronic condition that requires expensive treatments or drugs. On the point of without preventing or jeopardizing other services, while it's keeping people healthier and maybe reducing their need for some services such as ED or inpatient, it could also lead to a need for additional services in other areas. As people are staying healthy and more fit and active longer in their life, they may have injuries from sports. In my case, maybe about 3 years ago, I thought, well, I'm feeling pretty good. I can go out and try to run hurdles again, which I hadn't done for almost 40 years since high school. So you get people who just feel wonderful. Fortunately, I didn't get hurt, but that's a story for another time, Marie. But another thing that is increasing need for services is pickleball. Pickleball is a very fast-growing sport, and we have a strong orthopedic practice at our hospital. We're seeing more injuries because of the the desire for people to get out and be active. The way to adjust for that is having continual data analytics and monitoring on volumes in the areas. As services in one area are decreasing, we need to be able to shift those resources to areas where volumes are increasing. And it doesn't mean that we're not going to continue to provide those other services. It's just we need to redeploy people and look at their functions or their roles to use them where we need them, where volume is growing.
For sure. No, definitely. No, the pickleball thing, that's real. I believe that for sure. Yeah. Rich, what about you? What do you think about this one?
Similar, but I think the first thought that comes to mind in terms of the shifting of resources from preventative to preventative from our traditional episodic care kind of environments. It's going to take strategic planning and really careful, effective resource allocation, because we do. In our hospitals, we still see very sick people. Injuries, as Jim talked about, happen just as frequently as they did before. So, there will always and continue to be a strong need for acute care services in our facilities. But over time, I think that, as we prioritize preventive services and these advanced screenings and various disease managements, we do believe that I would agree that we can do that and maintain these critical acute services. I also agree technology is going to be a key. I don't know that we've touched too much on telemedicine today and remote patient monitoring, but we think of that as a resource to help, kind of reduce ER visits to some extent, and ultimately freeing up resources for more preventive care. I think it was in the last question, Jim mentioned primary care physicians, but that network is challenged today. There's no doubt that there's a shortage in many communities for that. I'll tell my personal experience that I had an appointment for my annual that I had to delay because of travel, and it took me 3 months to get back in with my primary care physician. And it's like, okay, and I was wanting, preventive care. Make sure I was in good shape and ready to go for the next year. So, I think that's something we've got to continue to strengthen and work on. A couple thoughts that come to mind here.
Yeah, no, for sure. Yeah, I think, like balance is a huge component to this. Lynn, what about you? What do you think about this one?
Yeah, the pickleball comment is fascinating to me because we use pickleball at Moffitt in an entirely different way, and that's more of a wellness benefit. So we don't necessarily see pickleball injuries. We use it to better outcomes for our patients. So fascinating to hear that. Rich, I love what you brought up telemedicine. I think if we rewind 5 years to when COVID happened, we were really terrible at telemedicine here at Moffitt. It was very minimal. And it wasn't even about the reimbursement. It was just, we had never been forced to think differently about how we could see patients in that capacity. So that has continued on over the last 5 years. And I think that really gives the opportunity to shift some of those visits that can be meaningful in a virtual environment and free up the limited capacity we have to see our new patients that need to be brought on site to have a meaningful first visit with their provider and get all of their labs and imaging done at the same time. So that's been a great shift for us as well, and has really challenged us to think differently. And again, if we go back to reimbursement, there's a lot of uncertainty in the reimbursement for telemedicine visits in the future. But I do think there will always be a use case to how organizations can use that to increase capacity and do some of these screening visits. The other thing, just from a screening perspective, that we have launched is you have to bring it closer to the patients. And so some of our patients, especially those in underserved communities, they don't have the means to have those visits. Or, to your point, it took you 3 months to get back in with your PCP. If you were getting screened for a cancer screening in that visit, 3 months could make a big difference in terms of your diagnosis. And so we have, as an organization, done things like mole patrol over the years, looking for sun cancer screenings. We just launched our new mobile lung bus that does free lung cancer screenings. So it's getting creative in the ways that you can use your non-traditional modalities to reach patients sooner, and not take up the limited capacity you have for some of those new patient visits that need treatment today.
For sure. No, definitely. That's a good point. Just being creative with like the options that you do have. Definitely. Good point. And yeah, we're definitely going to talk a little bit about tech today, because obviously that definitely plays into cost containment. So this year, I feel like we've heard a lot of AI talk. Maybe just from the tech conferences, 5 and HIMSS, I feel like I'm hearing a little bit more of it, or it's more ramped up. But as we get deeper and deeper into AI solutions and their potential, factoring in costs like governance and training, I mean, this definitely comes into play as well. So the next question I had was, as the healthcare landscape continually churns out these new AI solutions, what role do you think technological innovations in general, EHRs, AI, or telemedicine, what role do these have, or what do they play in reducing operational costs for health systems? Rich, do you want to go first on this one?
Sure. I think it's exciting to hear and think about what advanced automation and AI and large machine learning can do for healthcare to create efficiencies and drive patient care. I do think there's many organizations that we interface today or that are really on the cusp of this and trying to figure a lot of things out. When I think about EHRs in particular, their whole objective of those is to help streamline administrative processes, reduce redundancies, and help improve care coordination, which are certainly going to contribute to cost savings in many ways. I'll speak a little bit in the supply chain realm of the things that I'm excited about when it comes to potential AI solutions is really getting into some predictive analytics to understand kind of patient demand. And I know that's going to be key for our organizations as they think about staffing efficiently and as we get to labor. But for certainly on the supply chain side, it's helping us manage and maintain appropriate inventory levels. So it will help us think about ensuring that we have the right supplies when we need them, and really to have just a lot more predictive kind of information related to the demand on our supply needs will, I think, be exciting when I see them come into fruition. We are seeing advancements in inventory management tools that we can then capture that data to begin to build demand predictions. But I think we're somewhat on the early stages of that, but excited about what I think we'll see and the impact it will have on cost containment strategies.
Definitely. Yeah, definitely. There's a lot of potential there for sure. Lynn, how about you?
Yeah. Well, technology is my sweet spot. I love technology. If you think about the traditional revenue cycle, it was really human driven. And what we've done at Moffitt over the last decade is we've really layered in technology on top. So we have a technology empowered workforce now. Some of that is your traditional RPA, robotic process automation. If you look at the scale of my revenue cycle, I have about 600 FTEs. That number usually gives folks sticker shock. Oh my goodness, you have 600 people. I also have upwards of 400 FTE equivalent of automation that augments my team. So I look at that and say, we've been doing this for a long time with your traditional automation. AI is the buzzword everywhere, right? And so you really have to filter through the noise and say, what truly are you trying to accomplish? And at Moffitt, we actually have a whole data sciences team. We're very spoiled. We are a research institute, so we have a lot of very brilliant people that help us, come up with our strategic roadmap for AI. There's a lot of use cases in all areas of finance, but particularly in revenue cycle, we're trying to target the things that we would have historically used automation or emulators to emulate our team, and look to how AI can help us scale that as we grow. What does it mean for cost? So our key metric in revenue cycle is cost to collect. So I am looking to continually drive down my cost to collect, because every dollar that I can save and every dollar that I can bring in, we get to reinvest that back into research to find a cure for cancer. So we really have created this culture of innovation in our revenue cycle where technology excites them. But again, AI, we're just at the forefront of it. So we're coming up with all of our governance strategies right now. What is our roadmap for the future? I am very happy to say, though, teams like Revenue Cycle at Moffitt are looked at as early adopters for AI when we talk about having a generative AI platform within our walls, because we are quick to lean into new technology. So I think the future is very exciting.
Yeah, for sure. No, that's awesome. Jim, what about you? What do you have to say on this one?
Yeah, again, I'd echo Lynn. Revenue cycle functions really need to try to capitalize on technological innovations, because the pace of change in the revenue cycle is only getting faster and faster. And recruiting and hiring individuals to try to address those challenges is getting harder. The cost is high, but automating certain steps can really speed up the processes and help bring that money in, the cash, quicker. But AI and other technology is frequently used or looked at to reduce labor costs, but it can also reduce other costs. It can reduce possible errors in workflows, whether it's administrative or otherwise, and it can improve quality. If we can standardize processes to the point that they can be automated and take that human component out of it or reduce the human component, it can improve the quality. And anytime there's technology being implemented, there does need to be some human involvement in that. So it's not that we're necessarily eliminating positions, but being able to perform these functions more quickly and accurately to ensure that we're getting reimbursed the amount that we should be is critical. A reduction in an expense or a denial goes straight to the bottom line. You know, we can grow and increase volume, but when you add revenue, there's always expenses or discounts that eat into that gain. But reducing denials or expenses goes right to the bottom line.
Definitely, for sure. I feel like there's so much hype around AI, but I think deploying it strategically is definitely a big component to it. So kind of staying on the topic of AI and tech for 1 second, a big factor in implementing AI, I think a lot of people think of the impact it can have on that administrative work or administrative burden. So whether it is AI or another approach, what strategies can health systems employ to reduce that administrative burden and also streamline processes in order to cut some costs in the long run? Lynn, do you want to start on this one?
Yeah, we've been at this journey for a long time, and we continue to look to our front line to be the ones that bring the ideas, right? So what we have found over the last decade of doing this is our frontline team members have the ideas. They know what clicks that they don't like to do in the system. So we've done things like we've done high performer think tanks where, you know, either virtually or in person, we'll get some high performers in a room and say, what do you not like about your job? Walk us through your workflow and help us understand how we can make it easier. I do think that one of the strategies we've had at Moffitt that's been very successful is reporting directly up through me. We have what's called the Revenue Cycle Process and System Support Team. This is a team of architects, developers, analysts that do all the work within Revenue Cycle. And that gives us the ability to be at the elbow with the operational teams. And this team understands enough about the workflow in the system to really move fast in an agile approach to implement technology. They also do it small. So a lot of times, I think what organizations will do is they'll look at a process and they'll try to automate an end-to-end process. And that is a recipe for disaster, at least in our experience, because you will always hit something that you cannot automate. So what we try to do is, in a new team that is new to automation or artificial intelligence, to create that culture of innovation, it's talk to the front line and then get them excited in the work and identify those quick wins that you can really build momentum and buy-in off of. And once you have that, it's almost like the snowball effect. Everyone wants to contribute. But there is another parallel thing that you need to be doing as an organization, which is making sure that you're upskilling your team. So as you automate the mundane tasks, you need to be rewriting job descriptions and compensating your existing staff who's doing harder work to retain them. Because if you're not doing that, they're going to go somewhere else. So it is a constant cycle, and it's a beautiful one once you create that culture. And there's every day we're deploying different tactics to ensure that we're keeping that excitement around innovation and just the engagement of our frontline team members, because that is our talent that we will always need to be successful.
Definitely. Yeah, there's so many components that go into it, just in AI in itself, and how it will affect the team, the staff, for sure. Rich, how about you? What do you think about this one?
Very similar to some of Lynn's comments. I think one of the things I appreciated that she talked about is this has been a journey for quite some time, and whether we're really, wherever we are on the forefront of AI, it's really this automation of tasks that create efficiencies that I know have been focused for many of our partner organizations for years. I know of one in particular where they have a Department of Automation Excellence, which gives the opportunity for your staff and your teams who, yes, have tasks to bring and present those. And if it's looked at that they can determine and create some efficiencies, then there'll be an investment made in creating, whether it's using bots or other automated tools to create efficiencies that support and relieve the administrative burden. So I think those kind of, user employee-fed solutions are key to moving forward successfully. I've also seen an organization that is on the forefront of AI, but is looking across their various functional areas, rev cycle, supply chain, and looking for particular pods to work in, tasks to bring analytics around, again, in the hopes of creating efficiencies for our health system. So I think we'll continue to leverage advanced technology. One thing that comes to mind in terms of an alternative strategy is also, and I'm not sure we've mentioned before, but looking towards certain spaces for strategic partners, that may have core competencies that support the administrative functions. And I know, again, many of our systems manage their own supply chain internally, yet still have some partners, have their own rev cycle, but have key point solution partners that help kind of support and relieve tasks. So I think those strategic partnerships could also be a key piece of helping us continue to streamline the administrative burden for our hospitals.
Yeah, definitely. No, that's a really great point. Strategic partnerships, definitely important for multiple endeavors, for sure. Jim, did you have anything you wanted to add on this one?
Well, along the strategic partnership line, we are not large enough to have our own team devoted to developing AI or implementing it. So we recently engaged an external partner to work with us to do detailed walkthroughs of our system processes to identify opportunities for automating and use of technology. That included finance, supply chain, and revenue cycle. And we have our final report out, I think, tomorrow on some of the identified and recommended processes to automate. So I would recommend looking for partners that can help identify those opportunities and implement them. Because all of us have systems that over time, um, you continue to add people, one by one by one, and because it's a lower upfront investment, and some of these tools can be pricey to purchase and implement. So it's attractive to add people, but at some point, you will hit a breaking point where you need to implement some kind of automation tool because it's just going to continue to grow and grow. In revenue cycle, there's thousands of transactions, daily that can be very repetitive for task and very disengaging, that people don't really like to do. So automating can also increase their engagement and increase their longevity with the organization because they're able to do things that are more fulfilling.
Yeah, for sure. No, 100%. For our next question, I wanted to touch on tariffs just a little bit because I feel like a lot of the finance executives I've spoken to, I feel like a lot of people are not super concerned with tariffs right now, whereas others maybe are. But as tariffs and all these regulatory changes kind of dominate our news cycles, many leaders are bracing for the economic impact of these policies, whether it is in healthcare or elsewhere. So the question is, how important do you think supply chain management is in the overall strategy for cost containment within healthcare? And what best practices can health systems adopt here? Rich, do you want to start us on this one?
Yes. Now, I'll acknowledge I am probably extremely biased to this area as I shifted from a finance leader in a hospital to supply chain about 20 years ago, and it's been my space. Right. So I will tell you, I believe it to be critically important, and I believe the tariff pressures are real. I think there are strategies that we're deploying, I know, to support our members in trying to mitigate those things. We're supporting advocacy groups in their efforts to kind of drive exemptions in certain healthcare spaces, whether that's medical devices or other areas. But regardless of where it lands, there will be an impact on, inflation. And that's not to say we haven't already experienced enough of that over the last few years already. So it's really adding to cost pressures that we've really been dealing with, as significant as I've ever experienced in the last kind of handful of years. And the disruption that we've seen in our supply chain is greater than I think I've experienced in those 20 years. Obviously, COVID was a catalytic event, but from transportation breakdowns to natural disasters, all those things have had significant importance. So operating in an efficient and supply chain is critically important. And it's critically important to ensuring quality care and patient safety. And so, for me, I think what we've seen, what I've seen a transition to help kind of drive cost containment in the supply chain space over the years. Health Trust offers our members some support in many areas of the supply chain, but the areas that we've seen really increasing interest is helping them support in their processes in the OR, preference card management, really a focus on utilization management. We've got a team that has traditionally helped our members in medical device custom contracting, but we've really shifted that from, a contracting emphasis, which we still provide, to really helping manage and support utilization, high cost osteobiologics and those kind of things, and trying to eliminate variation and support our facilities in addressing those kind of things. One of the biggest challenges, and I'll kind of stop here and turn this over, as I could go on about several of the pressures, but one of the interesting things that I see our supply chains having to balance today is, ensuring that they have enough product on hand and redundancy in their supply chain to not stock out with all the pressures that we've seen, but balancing that with the rising cost of capital that has, I think, wanted our facilities to focus more today than ever on ensuring that we don't overstock our facilities. So again, we've talked about it a little bit today, but having efficient inventory processes and using technology to ensure that we have visibility to where we have supplies across our system are key to that. And again, technologies is playing a big part for many of our members in creating visibility that they really hadn't had as effectively before. So I promised I'd stop there. So
no, you're fine. Nice. Yeah, no, definitely. It's definitely like an important topic to talk about. I definitely wanted to dive into it a bit. Jim, what are your thoughts on this one?
Well, on the question of how important is supply chain management, it's very important. Supplies and equipment are right after labor, the highest cost items, or most of our cost in the organization. So having a strategy is critical. I have always started with having the right person in the chair to lead the supply chain function. Someone like Rich with the expertise, the intimate knowledge of everything that goes into managing the supplies we have on hand, the process of obtaining those items, as well as being able to look out and see what challenges are coming, whether it's supply chain from, during the pandemic when it was so hard to get products from overseas and have them allowed into the country, to the saline shortage due to Hurricane Helene. Having a team that can really manage that and be strategic about it is very important. That's where I start. But then Rich mentioned going a little bit off of the contracting piece, but for our organization, selecting the right GPO and ensuring we were purchasing items on contract has meant a lot for us. Also standardizing items with our multiple orthopedic surgeons so that we're trying to get the best negotiation leverage for implants and other supplies, has really meant a lot for us as far as cost savings.
Definitely, for sure. Lynn, what are your thoughts on this one?
Yeah, absolutely. So the cost of oncology drugs is probably one of our largest expenses. And so having a strategy around that is really important. And one of the things that we've done as an organization is really start to analyze that data. But it takes a cross-collaborative approach because it can't just be the pharmacy team. It also has to be the revenue cycle and your payer strategies team. Sometimes what we've found is we're reactive to changes in payer policies. Each payer will have, their list of preferred biosimilars. And if we don't know that those policy changes are coming, we don't know how that's going to change the pharmacy delivering those drugs and how that impacts reimbursement. So that's something that we are just constantly trying to, as a group, come together and have a strategy that is proactive versus reactive. Because if you're reactive to a increase in the cost of a pharmacy drug, then you're already a couple years out from being able to right that ship in terms of bridging the gap of cost versus reimbursement.
Definitely. No, good point. Being proactive versus reactive. I think that in itself can be a huge component to managing costs in general. So we are creeping up on the end of our time here. So I think we are going to stop at, with the slides there. And we're going to begin our Q&A portion of the program. We have a couple questions lined up already, but just a reminder to our audience, if you're participating with us live, if you want to submit a question, go ahead and click on that little Q&A widget at the bottom of your screen. It may already be open and appear on the left side of your screen. So just know your questions will be anonymous and won't be viewed by any of the other audience members. Thank you guys for all your answers. I feel like we really got into touched on some important topics there. Some of our questions, this first question we had says, well, Jim mentioned the cross-sector data sharing is challenging. How can leaders, oops, sorry, we got another one. So how can leaders assist with developing cross-sector data sharing when hospitals and physicians may utilize very different data platforms? Not all data platforms talk to each other, so to say, and generating a new platform that is compatible can be very expensive. What do we think on this? And anyone can answer as well.
Yeah, it is very, very challenging. Our organization is on Meditech Expanse, whereas most organizations in our area are on Epic, and most organizations in the country are on Epic. So trying to share that data can be very challenging. We have a team that we're really developing still to on the IT side, to be able to effectively and efficiently try to manage that data. In some cases, ACO arrangements or critically integrated network arrangements can assist with that. There are tools that can ingest that data and do the work of bringing all of the cost and services for one individual together to really coordinate that care.
Awesome.
I can jump in here as well. So you're in good company because we are not an Epic shop at Moffitt. We are an Oracle shop. So when it comes to opportunities around integration of data from different systems, we certainly have gone through that journey as an organization. Our data sciences umbrella has actually created a homegrown platform that they call MCAP, Moffitt Cancer Center Analytics Platform, and it has feeds from all of our different systems into one platform that then gives us a foundation to level set and really to take action on off of that platform to enable us to be ready for generative AI use cases. So that was a multi-year strategy and journey of that team, but we're seeing the fruits of that labor now. So I think, it takes a lot of investment of an organization to recognize that we have an opportunity to consolidate our data and then to actually make that investment to see that to fruition.
So, all righty, let me get our next question up. So our second question was, what strategies are you guys working on around reducing length of stay? Have you seen any significant cost savings from specific strategies that you have implemented? It's a good question. And again, sorry, anyone can answer. You might not me to call somebody. Feel free to answer.
So I can share something that we've done more recently, as we have some changes in our physician leadership, both at our physician in chief and our chief medical officer level, is we're really, as a finance group, trying to help be at the elbow with our providers, linking how the clinical care that they're giving relates to reimbursement. Now, I'm going to bring this back to length of stay because in oncology, there are many treatments that can be given safely in an inpatient or outpatient setting. And so some of the work we've done is actually to educate around those clinical services that are safe to be given and just as effective to be given in an outpatient environment, and how that can then free up our beds for those patients that need to be seen in the inpatient setting. I know that isn't directly correlated to the length of stay, although what we have seen is a shift from inpatient to outpatient care. And some of it is just understanding how the clinical pathway then accompanies the financial outcome of those services.
Interesting. Yeah, definitely. I know it's different for you guys. It's always interesting to hear from Moffitt, Lynn, because of your guys, your workflow and everything. Yeah. We have
a couple things we're working on. I'm sorry, Marie.
No, you're
a
fine.
couple
Go
of
ahead.
things we're working on is around some of our surgical cases. With so many procedures moving from inpatient only to outpatient, we've needed to really look at how we're managing those patients before they even come in to ensure that they're able to receive all of the post-surgical care needed in order to send them home the same day. We've had a lot of joint implant cases where even though it's being performed on an outpatient basis, the individual spends a night in the acute care unit. So it's working around managing the care ahead of time, the rehab needs, discharge, before they even come in. Another area where we have excessive avoidable delays is in discharges to post-acute care settings. And our teams, our care coordinators, our case management individuals are working on solutions around those discharges and how we can try to shorten that length of stay. There isn't an excellent solution for us right at this point, but we have a great team that's working on both of those situations.
Awesome. Cool. Well, thank you all. I think we are going to have to wrap up here. We are at the end of our time, but it's a great discussion today. So in closing, for our audience, please note that our next program is going to be on April 8th, and this is going to cover the winning edge for clinical AI implementation. So that'll be a good discussion there. A live clickable link is going to appear at the close of this program. This is going to take you to our registration page for the event. So just remember to follow along all week as we cover cost containment on our website, healthleadersmedia.com. And lastly, I want to thank our panelists once again for an excellent discussion. I feel like I learned a lot. And thanks to our sponsor, HealthTrust, for making today's program possible for us. And finally, thank you to our audience for participating. We hope you enjoyed today's program and look forward to seeing you during our next program for clinical AI implementation.